Hi, I'm Daniel Nyman, and on behalf of the Forum for Healthcare Strategists, as well as our colleagues at Freshpaint, welcome and thank you for joining us for Mastering Healthcare Marketing, Tracking Compliance and Data-Driven Success. Healthcare marketers are working harder than ever to attract and retain patients. But how do you measure success? And how can you track patient interactions online while staying HIPAA compliant? In today's webinar, you'll have practical result-driven advice for connecting marketing data and compliance to optimize performance. The discussion will feature three healthcare marketing experts: Alex Pina, Director of Marketing Technology for Baptist Health, South Florida; Matt Crowley, Senior Vice President Digital at MoreVisibility; and Ray Mina, Vice President of Marketing at Freshpaint. One note before we begin: if you'd like to ask a question, please enter it into the question and answer pane located on the bottom of your screen at any time. Our speakers will respond to as many questions as they can in the time we have. With that, I'll turn the program over to Ray, who will be leading today's discussion. Ray?
Hey, thanks, Daniel. Really appreciate it. And Matt, good to be back with you. I know we've done a couple of these and some podcasts together, so always love hearing your insights. I think our title today probably doesn't fully sum up all the things we're going to talk about, but data is at the center of it. We're going to get into a lot of the things that are on the minds of healthcare marketers. And we brought a friend, Alex Pina from Baptist Health in South Florida, living in the luxury of Miami versus me living in the snowy mountains around Lake Tahoe. Very different universes. But maybe, Alex, you could start us off by just introducing yourself and tell us a little bit about your background, especially when it comes to your experience in consumer marketing.
Sure. So, hey everyone, I'm Alex Pina, Director of Marketing Technology for Baptist Health South Florida. So just to give you a background on Baptist Health, we're a 12 hospital system spanning four counties down here in South Florida. We are the largest in the region. We have about 200 outpatient centers and a little bit over 28,000 employees across the system. So in my role, I oversee the marketing technology stack. It includes various systems along with some of our API integrations, and then our internal marketing tools, so project management tools, our DAM. I also oversee our listings program, and then right now I'm really just diving headfirst into AI strategy. I mean, it's today when you talk about technology, you have to talk AI, just because there's so much going on there. And then as Ray had mentioned, I come from an e-commerce background. In e-commerce, you're basically doing anything and everything, throwing the kitchen sink. There are no real crazy rules. And then I moved over 4 years into healthcare, and then all of a sudden I have to deal with a ton of different regulations. HIPAA, anything you can think of is kind of hanging over you in terms of marketing and tracking and what you can do. So it's been a fun experience, but just trying to kind of get a handle still at this point. At 4 years, you're still trying to, there's new things that come along all the time. So it's been a fun ride.
Alex, are you a Matrix fan? Did you watch the series, the movies, The Matrix?
I remember when it came out. I watched it, but it's been a while.
There's like a famous part in that about being red pilled, like you learn
Oh,
something that, yeah, right? I
yeah.
feel like healthcare marketing, like the rest of the industry is being red pilled to death by like AI and advancements. And marketing is still kind of stuck with the blue pill because even though they might be starting to learn about it, they can't do a lot of that. So I'm really looking forward to getting into, how you're navigating some of that stuff today.
Yeah, it's definitely been a fun challenge there with that.
Yeah. Matt, yeah, good to see you again. Tell us a little bit about yourself and more visibility. I know you're really in the weeds with a lot of the topics we're going to talk about, especially when it comes to using data to leverage, outcomes for healthcare marketing teams.
Yeah, thank you. I'm super excited to have the conversation today, and certainly, the three of us really go back on different capacities, many years at this point. Ray, you and I have had many of these sorts of conversations, and Alex, we've worked together for a number of years now. So I'm always excited to talk about some of these different areas that we don't necessarily get the chance to talk about on the day to day, and kind of have a longer form conversation around. My background as Senior Vice President of Digital at MoreVisibility is to oversee all of our teams of specialists that directly work with our clients in the areas of advertising, SEO, content, analytics, and creative. So we are a full service digital marketing agency, and my role for a number of years now has really been focused primarily on integrating these different areas across a wide variety of industries and bringing perspectives from one industry to the others. Healthcare is a big area of focus of ours and has been for many years, but we also work in a lot of other verticals and love bringing insights from those other industries to our healthcare partners. And vice versa. I think that there's a lot to learn, as you already mentioned, and certainly Alex has the perspective from the sort of e-commerce and direct to consumer background, that I think that there's a lot that can be learned, and I'm sure we'll talk about some of that today from some of these different industries. So I'm super excited to just talk about what we're seeing in the landscape, what we're hearing from a lot of our healthcare clients, some of the different directions that we've seen be successful, some of the challenges that we've seen, clients face, and really just mostly be a voice to them. Alex, I think is a great voice from one perspective, and I'm hopeful that I can add some other perspectives from other healthcare organizations out there that I talk to regularly.
That's awesome. Yeah, I can't wait to get more of your inputs. I'll just cap it off. I'm Ray. I run marketing and product at Freshpaint. We help stand up a lot of the advanced digital marketing strategies, but in a legally blessed way that legal and compliance teams can feel that they're assuaging the concerns around privacy. And I'm really a spoiled B2B SaaS brat. So like Alex, I'm used to being able to leverage data to segment my audiences and use that data for not only more effective acquisition campaigns, but like to push people through the funnel to the desired outcome. At Freshpaint, that's becoming a customer and investing in partnering in our platform. And healthcare has been kind of a wake up call to me of how it's really hard to grow businesses even when you're unconstrained. But when you're constrained, it's like infinitely harder. And we're going to get into some of those challenges that people are facing today and hear from Alex and Matt on ways that folks are creating new ways to get around some of this stuff. Not get around it in the way of ignoring it, get around it in the way of being creative to check off both boxes related to growth and privacy and taking care of consumers. So the way we're going to do this today is this is really going to be a discussion. We're not going to blast you with a whole bunch of slides. We really have 3 slides, 3 major topics. We're going to talk about some of the biggest impacts to healthcare marketing. We're going to talk about the balance between privacy and performance, really about how getting data that you need, but in a way that checks off the boxes for legal and compliance teams within healthcare. And then measurement. This is one of the areas that is really important as we continue to scale our strategies. Just making sure that we can measure it. It's not just about measuring to show and prove that it's working. It's to aid our decision making. Like, how can we know where to invest more dollars? How can we know how to iterate on strategy if we don't actually have like really great metrics? And then we promise we're going to save some time at the end for Q&A. So if you have questions throughout, there's a Q&A section in Zoom. They conveniently built that little button. Just throw the questions you have if there's an area you want us to dive deeper, and we'll do our best to answer all those questions. So the format here is we're going to launch a poll for each one of these slides. We'd love for you to weigh in. I'll talk through the question and then the different options. We'd love for you to weigh in. If there's something in the bullets that we, for example, the first one is what are some of the biggest shifts you see? If there's not a bullet up here for what you care about, I would love for you to like throw it in the chat, and that could be an opportunity for us to discuss it. So here's the first question. Which of the following do you see as the biggest impact to healthcare marketing in 2025? Like what are the ground movements that you're seeing? So a couple of things that we talked about before this call were there's a change in the population. We're seeing an aging population and an increased demand for care. That affects healthcare from providers all the way to health insurance companies, payers, pharmacies. We're seeing, I would just lump the second one as a capacity constraint. Like, people might need services, but the availability of those services don't exist for many reasons, including a shrinking workforce. Alex tapped onto it. I can't wait to hear Alex's view on AI. I've seen both sides of this, being anti-AI for concerns of privacy, and the only way forward is AI in healthcare. So there's definitely like a lot of debate happening. Competition, not just from healthcare, but competition from not traditional healthcare, but competition from players that live in the consumer space moving into healthcare markets like Amazon. And then budgets just getting really tight, and then privacy regulations that kind of limit where you can actually use those budgets. So everyone, please just maybe take 30 seconds to check a box if there's something that is representative of how you feel, and then if not, please do jump into the chat, and then the three of us will take a look at the poll results and start the conversation. Alex, how much before while we're waiting for people to how much of a threat are you seeing from competitors that are not traditional health systems? Is there a future state where like privatized medicine becomes like the biggest competitor to, traditional health systems?
I think, we've seen, like you mentioned here, a few of them, Amazon, CVS, Walmart, uh, Walgreens, we've seen come in and out. I think they're out now. I'm not sure. It fluctuates so much. And they're really playing in spaces that typical healthcare companies would be in.
Yep.
Then they have the background of being incredible with customer service and on the consumer side. So it's kind of made the healthcare industry as a whole have to step up, because when it comes to a company like Amazon, they're going to figure it out at some point, right? They kind of came into at the beginning, it was a little clunky, but little by little, you see them start turning the gears and start figuring out. So to us, it's just we just need to pick up our game and make sure that we are getting to consumers in the right fashion.
Yeah. Can you both see the poll results that are published here? What
Yep.
Just popped up.
is there anything here that's surprising based on how people attending this webinar have voted?
I think the competition piece being low is maybe a little bit surprising. Other than that, this looks very similar to a lot of the conversations that I've been having and hearing in a very similar outline. I don't know if it would be exactly 1 through 5, how I would map it out, but probably pretty close to what I would have expected.
How about you, Alex?
Yeah, so I would say my two front runners look kind of low. So, I'm like I mentioned on the players that are coming in, that's a big one. And then also AI's growing role, I think is another one that's going to be a big one. I mean, it's really a wild card just because we've seen it. I mean, just picture what AI was just from like January 1st to now. I mean, we're seeing these seismic shifts weekly, really daily coming through. I follow this stuff like crazy, and I have a hard time keeping up. So even the experts sometimes will have a hard time telling you where a lot of this will end up. So that I think is just from the wild card factor really, increases that piece as something that is shifting in healthcare. But on the other side, I think that is a lot of good that will eventually come from this. Like exponentially expanding personalization and predictive analytics that we can perform. I think that will probably be some of the bigger impacts that we'll see there.
Without giving away any, competitive secrets or anything like that, because you just did state that competitive pressures was a big part. Let's talk about AI for a minute. Like, it's a pretty broad, like if I say AI, even at we use AI in marketing at Freshpaint, that's a pretty broad statement for me to make, because it could be anywhere from like leveraging AI for, customer interviews to better summarize things, to AI that pulls in multiple data sets to try to like triangulate on segments. If you were to put like on an area of AI that you think has the biggest potential for impact for sort of the marketing muscle, within healthcare, where should people start to investigate? Like what's their starting point?
Well, I think there's two sides of it when in healthcare. There's the clinical side and then the operational side. Marketing, support teams, all those type of things. I deal more on the support team side. The clinical side's a whole other animal. But really, it's about getting leadership buy-off, getting like an AI council together, a team that can explore and really bring some of the best ideas out. And then really it's about testing and it's evolving so quickly and like I mentioned, just every day it's different. It's really just jumping in and playing with the tools and understanding what they can do and how they can help you. A lot of times it's just taking a step back and asking yourself, can AI help me here? Can I do something here? And then move forward from there.
Matt,
Yeah, and
question? No, please. Yeah, go
yeah,
ahead.
I was just going to jump in there and say, I think, what we've seen on the AI front for marketing is that it's been very, Alex used the word explore, and exploration has really been I would say probably the most common theme to those that are, who knows, but I think likely to be successful or get the most value from it. It's been very wide and not very deep. It's been a lot of use, a lot of testing across many different areas and learning. And there's a lot of learnings. I think there's so much hype out there right now from all of those who are economically incentivized to hype AI, all of the people making the frontier models, all of the software developers who are integrating AI and marketing that as a capability to espouse these really comprehensive use cases. But what we've seen is that it's much more nuanced than that, even for things that it's very good at. And so exploration being a very common theme of those that are learning the most at this point and taking a very wide approach and not setting yourself up to have an extremely detailed, in-depth 5-year plan for exactly how everything's going to get rolled out, because it is changing so incredibly rapidly. And so I think those common themes of width, not depth, exploration, learnings, and then sharing those learnings and identifying, how to move beyond it is key. And that lastly, I'd say that, a lot of people talk about use cases. I found that maybe a little bit less effective because everything gets lumped into one, like, we're going to leverage AI for content production, but content production is incredibly wide. It's copy, it's video, it's assets for advertising. And even if you say copy, it's there's medically peer-reviewed copy down to a description tag for a page on a website. And there's so many different tools out there, so there's just a lot more learnings than I think a simple straightforward AI is going to solve this very broad problem. And that's going to take a lot of exploration and learning and sharing of those learnings.
Yeah, it sounds like it's in a similar space to where we're at in the B2B SaaS world, which is a lot of experimentation to see what are the things that are fun to try once, but not worth spending a lot of investment on, and what are the opportunities to like really dig in and transform how we do things. Since since most people, it seemed like the overwhelming, I didn't expect this, but the overwhelming response around impact was around budgeting, budgets and privacy. I want to separate those two, and I kind of wish now that we had separated those questions into two different buckets. But Matt, maybe since you have exposure to a lot of different, healthcare clients that you work with, can you touch on the budgeting side? Like I've seen mixed. I've seen people who are actually able to get more budget because they do have capacity and they're showing like good results. And I've seen organizations where like cut after cut after cut because of low margins. What are the general trends that you're seeing right now?
Yeah, I would say it's mixed, but I think it's generally uh, tightness and or efficiency, I think are common themes throughout. Even if there's expanding budgets, it's how can we allocate those more effectively and continue to be more efficient. I think one note I'd say just in looking at the poll results too is, there might be a component here of, urgent versus important, and, tighter budgets, privacy regulations, accessibility challenges are all very like urgent problems that, we hear people facing now. AI, some of the increased competition from non-traditional competitors are important, but maybe not quite as urgent today. And so I wonder how that plays a role in some of the responses, because I think that's kind of the thematic, the themes that we're seeing. In terms of budgets, kind of a broad perspective, amalgamating a lot of these different conversations into one that we've seen is, we have seen a lot of people share that there are challenges with accessibility on appointments. I've seen this myself with my son trying to get a specialist appointment. It can be many months out, from being able to see that specialist, and some of a lot of things, but the workforce challenges impacting that, and then you have that combined with the increased competition, making it even more problematic. And a lot of the, historically from a digital marketing standpoint, advertising dollars have gone to that like appointment scheduling side of the fence for many years, and or increasingly so. And brand has been lagging behind from a budget allocation standpoint. And so what we're seeing is a lot of rethinking of that strategy when you have less availability in appointments. Therefore, should you be spending as much of your budget on driving appointments that you may, not have, or may lead to disappointment on that patient, versus brand. And brand and digital, as it also ties into AI, I think that there is a tremendous opportunity there to focus for many healthcare organizations more on brand in a digital space, in that with AI and increasingly just all the machine learning and personalization capabilities, you can have a much more nuanced approach to brand, much more personalized approach to brand in the digital space than maybe in some of the traditional out-of-home spaces that are a little bit more mass market. And so I think what we're seeing as it, relates to budget is, a little bit of misalignment over the last year or so of the difference between brand efforts and, driving to a very specific conversion like a digitally scheduled appointment. And then a lot of these other things compounding that, the increased competition, making brand more important, but also the privacy regulations, making it harder to measure, the return on investment for scheduled appointments. And so those are some of the broad themes in terms of challenges that we're seeing. And the budget's playing a big role in terms of then, how are you going to, handle your allocation of dollars? Or if you've got a tighter budget, but you've got access issues, are you going to be able to justify the investment into brand?
Yeah, that's a great. I'd love to ask a follow-up here, Alex, from your perspective, because I really align with that. Like as a B2B SaaS marketer, I'll start at the bottom of the funnel to make sure that that's really shored up, because I do have, like in healthcare, I do have service lines to represent, so I want to make sure that I'm driving patients to the service lines. But at some point, there's a point of diminishing return, and like marketing isn't just Google Ads. Like we have to layer in education and awareness. One of the struggles I've had in healthcare, as I talk with a lot of leaders, is that a lot of the strategies that I would deploy to connect that funnel, like the reason I want to create awareness is because I eventually want to move people through the funnel to the services that I can help them with. But things like sequential marketing and retargeting and building lookalike audiences to segment, those are like really hard for a lot of healthcare marketers, given the guardrails of privacy. And I'm kind of curious how you think about not specifically those tactical use cases, but I'm curious about within the constraints of privacy, how you think about linking the journey from brand to actual patient.
Well, I mean, tracking has definitely become more of a challenge in terms of attribution. You have all the, without the third party tracking, it's hard to make that connection. It makes, trying to track it from a booked appointment all the way down to an actual interaction. it creates some challenges. Plus, healthcare systems are pretty notorious for having just multiple systems across the board, in different departments and different regions, especially, hospital systems that are acquiring other hospital systems or other hospitals and facilities. You have kind of this smorgasbord of systems that you need to streamline to be able to get that data out. So it's not always so clear cut. I think sometimes you have to get that seat at the table with IT because they're usually be driving a lot of those systems, and making sure that you're in the loop when a lot of these decisions are made, so that you're able to get that attribution to flow down, all the way down into your data.
Yeah, this is the journey that we're all on, right? Is figuring out new ways that we can actually attribute, because you can't just run brand marketing. You're not going to have a budget for very long just running brand marketing without being able to prove like the actual business impacts of it. At least I'm not. Like, the board is not going to let me run with that money for so long.
Yeah, and I mean it's hard because brand marketing is more of a long-term play.
Yeah.
You gotta really shape that perception and trust. Whereas, with performance marketing, you get those conversions. It's more of the e-commerce transactional type. It's something that you can kind of trace back. So brand marketing sometimes is a harder sell, within the group.
I'm going to go take us back to the slides here and move on to the next question. I'll read it out to the audience before we launch the poll. So next topic I want to talk about, and we've actually been touching on this a little bit, so this is a good time to get the audience to weigh in. When it comes to balancing this concept of privacy and performance, right? Like measurement and performance, data is at the core of it. What are the biggest challenges that people are seeing? So like tracking patient interactions while staying compliant. Teaser, I saw a question come in already about the difficulty here. Everything's getting attributed to Google Ads, which we know isn't true. How do I track more effectively? Alex touched on this loss of third-party tracking, and now we have to make adaptations to a first-party world where it's your data, but you can't freely share it all with these native platforms like Facebook and Google. Personalizing marketing, like how do I create a more personalized experience for consumers while also minding privacy? AI is a big driver here, but there's cautions and safeguards we need to put in place. Internal collaboration, like the legal compliance team has a whole bunch of concerns that are not marketing concerns. How do we level set and align there? And then, overall, like how do we just make sure we're able to effectively truly measure ROI under these new privacy restrictions? So, Daniel, if you could open the poll, would love to get the audience to weigh in. Yeah, please take 30 seconds to a minute to weigh in here. I guess from you, Matt, because one of your superpowers, as I've gotten to know you over the years, is to figure out ways that you can stand up better measurements. The answer here isn't like give up on measuring lights out. And you and the MoreVisibility team have done a great job of figuring that out. How are you seeing people navigate this moment where it's, third-party data kind of goodbye, cookies eventually, like Google keeps kicking the can, but that's going to be gone. Like there's no looking back. It's just a matter of what they're going to replace it with. How do you navigate this?
Yeah, it's challenging for sure. There's, and especially from, someone who is a consumer of many SaaS platforms and working with many organizations that are consumers of SaaS platforms, there's an increasing amount of options here, and it's increasingly challenging to figure out which one's going to be the best fit and how it's, what the pricing structure looks like and what problems is it going to solve, and is it going to be a more niche case or a more niche solution to one problem, or it's going to cover many problems. So it's definitely challenging. There have been several times over the past few years that have been moments that really, I think, are ultimately in the long run valuable points that are forcing mechanisms to cause an organization to stop and rethink where they're heading and how they should evolve. And I think a lot of people talk about it from a pivoting standpoint. I like to think about it as if you're, climbing a mountain. You're the peak is still your goal. That's still where you're trying to get. That's not changing with any of this, but you're going to reach a certain plateau and a point where you can rest and stop and think about what is the best path forward to the next location. And everything with going on with AI, with privacy, with compliance, all of these are great times to stop and reflect on, do you have clarity on ultimately where you're trying to head? And then are you being very clear internally with the choices you're making and how they're getting you to the next step? And I think a lot of people are looking to just implement something that's going to immediately get them to the peak. And I think that's rarely the case. And I think that's important context, because as you think about that, then it's really important to make sure you have clarity on each of these steps. A lot of what we were just talking about was attribution, but that's part of it. Do you have clarity on what your overarching goals and objectives are? Do you have clarity on how those are being measured? And then do you have clarity on how you're handling attribution back to what drove those things? And there is no perfect attribution solution, certainly. And so knowing that and admitting that, and then saying, okay, well, let's choose a solution that fits our needs best, but let's be aware of the complications with it. And let's use it not from a accounting standpoint for attribution, but let's use it from a standpoint of going back to our goals and objectives, and relationally, are we heading in the right direction? Are these things helping or hurting us? And then there's a variety of different levels depending on an organization's spend, how many channels they're in, to go beyond attribution to things like media mix modeling and incrementality testing, to get an even better perspective and even higher confidence on what's really, moving the needle. So it's a long journey and path, but I always find it most helpful to make sure you have context on the overarching goals and objectives. Is everyone clear on that? Are we measuring those things? And do we have high confidence in the accuracy of that? And then how are we handling attribution and admitting that it's not perfect, but it is going to help us be used for relational determination of, are we moving in the right direction? And then after that, do we need more sophisticated tools to help give us even higher confidence?
Yeah, I agree with your point about attribution. It's as much a qualitative decision as it is a quantitative output. Like, you have to decide what kind of attribution model you're going to stand up. It's not like you're going to plug something, out of the box. It's going to work for every scenario. Alex, how do you feel about how does this align with how people are thinking about this? Any surprises for you here?
No, I think it was pretty on the mark. Like I mentioned, tracking attribution is just becoming more difficult overall, and with all the different regulations that are coming in, and sometimes you get some contradicting guidelines on which way to go. It presents a bit of a problem. Even with jumping back to AI, which, like I mentioned, in all the time, Google's even toying now with launching an AI search only, like where it's basically AI mode, and it's just, so then it's, how do you change your SEO and your paid towards that? There's just a whole bunch of factors that keep coming in. I think the way to make it a little less painful is really getting a good internal collaboration going between marketing and IT, and moreover, really with compliance and legal, and make sure that you're in lockstep with everyone, and make inroads there. That way, you have the latest and greatest, and you have folks that kind of deal in the fine print, and can kind of help guide you through some of that, to make sure that what you're doing it plays well.
Can I ask you, I'm curious of your opinion, and Matt, I'd love for you to follow up with your thoughts. I hear the word personalization in healthcare all the time, but I kind of am irked at personalization in healthcare because I don't know what it means. Like it could mean like so many different things. What do you think we mean in healthcare marketing when we say, because a lot of people raise their hand like we really want to improve our personalization and we're concerned about how we can do it because of privacy. That's a really common theme, and you saw it here with almost a third of people saying that was an issue. But what are we trying to do that we can't do, or what are we trying to do that's hard to do?
So really, it's just being able to create this unique experience that is geared more towards the actual to the actual patient. Um, you know, serving up the right information at the right time. And we have a whole team that handles that. So I'm not in the data with that, but really it's about just being with the patient throughout the journey, throughout the channels. You have just so many different channels across the board. Um, you know, um, Within like the patient portal, the unauthenticated experience. It's two different things. So trying to just make sure that the patient is getting one streamlined experience, whether they started online, whether they called or walked into a clinic. They should feel that it is one seamless experience that they're getting, and just eliminating all the friction points that you can. And so really it's kind of investing in technology to make that more efficient and effective.
This is more about that one-to-one, follow the patient through the journey all the way from like
Right,
pre-acquisition to post-acquisition. It's not just like personalized web pages or nurture streams. There's a lot, maybe even like
right.
coming in and being able to find the appointment available at the time I want near me because I'm, a dad who's like managing work and kids, and I've got like there's a lot of elements to it, it sounds like.
Personalized web pages, that's a small subset. It's
Yeah.
definitely there. It's a small subset in a bigger piece of personalization.
Yeah, when I hear it most often, I think it does end up meaning a lot of different things to different people depending on what their focus area is. But I think it generally, I think when I hear about it, it comes from a very good place of, you know, if it's coming from marketing, it's how can we best support the organization and the people, the humans that are looking for care or information to, as Alex said, eliminate friction points. How do we get them what they're looking for as easily as possible, make it as easy for them as possible to find what they're looking for, and make that journey as seamless as possible. But I do think that sometimes it gets a little bit you have the lose the forest for the trees type of situation where it's almost like then the thought might become in extreme circumstances, we're going to control as the organization the experience and the journey. And you can certainly not control, you know, everybody's journey.
Good
It
luck.
is
Yeah.
so incredibly vast and complex. And with all of the changes and the consumer landscape, and as Alex mentioned, how people are using AI to find information online. Things change so rapidly that if you were to concoct a journey that it's not going to be followed by everyone or even by a majority of people. And so, I think the intent is good, but I think sometimes it gets taken a little bit too far. And for example, you might lose sight of how do we just make sure that what we're doing is as helpful as we can possibly be so that when people need something, it's easy for it to find without having to force them into our specified journey. There are certainly helpful things with automations to, if you know exactly what they're looking for, assist them along that way. But when it gets to trying to control the journey is, I think, when we see it get a little bit too far. And so in order to do that, be more helpful. I think a lot of the times people think about, well, let's get more data and then let's use that data to know more about the person and offer them what they're looking for more efficiently and effectively, which comes from a good place. But I think that that can only take you so far when you do have limited data, especially in healthcare. And so I think what sometimes gets lost is, even back to the brand conversation, how can we make sure that we're have a smart strategy for surfacing our brand so that when people do need something, they know that they can come look to us first for that thing, and that when they come and look to us, just using one specific example of their website, it's not that we have a huge website with all of these pieces of content that we can personalize and send to people. It's that we have a clear, easy to navigate website so that based on what they want, they can find what they want. And that doesn't require any personalization. And so I think it's a balance. And I think that sometimes people take it a little bit too far with wanting all the data to feed into the systems to control the journey. And that's where I would recommend a more balanced approach.
I couldn't agree more. I think we're victims of the Ubers and the Facebooks of the world who have a very limited number of options that a consumer like Uber, order food, get a car. Like there's not a lot of options. And they use massive amount of data and experimentation to try to force us into the more expensive car or the $100 order versus the 50 order. That's not healthcare. Like every single consumer is quite nuanced. I'm gonna pop over.
Ray,
Yeah, please.
yeah, just one quick question. I know we got to make a little bit of progress, but for
Yeah.
you, I'd actually love to hear your perspective. I know it was a lower percentage answer, but the integration of the different teams, the collaboration between marketing, IT, and compliance. I know, from your side of the fence, working with many healthcare organizations that are having to figure out how software fits into the mix. There's many different teams with competing, priorities and goals and objectives. I'd be curious, just any quick 2 cents you have on your perspective there.
Yeah, thanks for asking. Yeah, I have a lot of empathy for both for folks on this call who are on the marketing side and folks on this call who are on the legal compliance side, is that you were working in two different worlds. Like I'm a marketer, I need data to perform. You're on the legal side, you would rather me just shut off the data because then I've de-risked everything for you. But it's like this balance, and a lot of the balance requires education and collaboration, and it's not like a one-time conversation. Like things, as Alex said, continue to change, and we continue to iterate our strategy with AI and other things. So we just need to figure out ways to build better relationships. What the organizations we've seen innovate the most within the constraints of privacy have good working relationships. It doesn't mean they agree on everything, but they have good working relationships and frameworks to keep navigating there. There is no world where you can just ignore your counterparts on either side of the organization at this point. I don't know if that connects to how you feel, Alex, with internally within your organization.
Yeah, no, 100%. It really is getting with your compliance and legal teams and your IT teams and all working as one. I've seen the more and more that happens, it makes things a lot easier, and every group gains a lot more trust in what's happening. Whether it's monthly reports or monthly meetups or whatever it is, it's just making sure that those teams understand that, hey, we're working with you. We understand what you need from us, and just even on that, like on the Freshpaint side, I love the fact that when you turn on some of these tools, it's basically everything is turned off, and then we're going to decide what we can turn on, and I think that sits well with the compliance and legal teams, so they know that what will be turned on has been vetted.
I'm going to go into our last topic here, and the good news is I think we've covered a lot of this, so we can go through this more quickly. But before we launch the poll, which area we're talking about, like attribution and measurement, but which area of measurement is the biggest challenge in 2025? Proving ROI on marketing efforts. I have a feeling I'm going to know the answer here. Tracking patient journeys across multiple channels, aligning digital marketing with the brand building side of the business, and then just overall ensuring that privacy is shored up while we're measuring these things. So Daniel, if you don't mind launching this last poll, and if everybody would take 30 seconds to weigh in and let us know where you're at. I think we've talked about a lot of these things at length throughout this discussion. The one area, Alex and Matt, I'd love to hear from you on is this integration with, because you brought both of you have have mentioned something I think is really important. Not everything can be measured like Google Ads. If it could, they'd all be, $150 billion a year advertising models. Google Ads is so good because it's a click-through conversion direct response platform that you can measure all the way through pretty effectively to the thing you want, whatever that thing you want is. But other things we do you don't do them to get a direct response. You do them for education, awareness. I'm really curious how we think about that. Like and you've alluded to them, Alex, but what are some of the common sense ways that when you're building brand level campaigns that you're thinking about measuring them so that you can actually know that they're working?
I mean, it's definitely getting harder, and it's not easy. It's not easy right now. You have patients moving between, digital ads, social media, search, provider websites, call center. I mean, you name it, and patients are on it. So trying to keep that all aligned between multiple channels, I think is probably the most difficult way. I mean, a patient can come in and research online and click on an ad a few weeks later, then call a clinic and schedule through a patient portal, and it's how do you keep all those things aligned? I think kind of sets the base for that, and how you get some of that data in, with all these linear journeys. Definitely, when you're talking about two experiences, whether you have, an authenticated experience and unauthenticated, it's way easier when it's authenticated because you know what that patient is doing, in terms of their healthcare and what, they've given you permission for that. But when you're dealing with unauthenticated, that's where you have a lot more of the privacy items kind of leaning on you, and you have to try to figure out how can I get some of this data, and sometimes it may not be perfect, but you kind of have to infer on some of it.
Yeah, and
Yeah.
I agree with everything that Alex said, and I think that the common theme of it being imperfect, I think, is important, and I think making sure that there's context around, what's being done and why from a measurement standpoint. There are capabilities for incrementality testing that require higher spend running many channels that aren't solutions for everyone, but are solutions for some that, get you further down the way of higher confidence on what's really driving, what's really driving the return, even in complicated user journeys. But it's certainly, everything else below that can be very helpful and may be good enough, but is imperfect, and I think just requires a lot of alignment and buy-in back to the relationship building pieces, not just in marketing, but across the organization. Are we aligned on what our goals and objectives are, what we're doing, what the intent and purpose of those things are? And then with the data that we do have, knowing the limits of it, does it look like it's helping move us in the right direction, or not? And a lot of those brand building efforts, there's the, whatever the particular percentage is for you, but there's the, 5 to 10% of people that are looking for care now, and then there's the 90% of people that aren't, but are going to. And are you only focusing on spending all of your dollars on the 5 to 10% that are ready now, and losing sight of the 90% that aren't ready but are going to be? And how much more efficient is it going to be if they remember you when they're ready? They don't even need an ad. You don't even need to pay to bring them in for the direct response. They just know you, or convert at a much lower cost. And so, I think there are some of those conversations that may need to be had to make sure that the purpose of some of these efforts is clear, the value of them, and that we don't need to have an accounting system that tells us, this particular channel that's branded returned a, 4.3x ROI at X dollars in lifetime value.
We haven't touched on this, but maybe we can make it quick, but maybe we can spend a minute or two here before we wrap up and take a few minutes for Q&A. What we haven't talked about is the other layer of complexity in healthcare, which I don't have in B2B SaaS, which is capacity constraints. So there's all this complexity around measuring stuff, even just holistically, But now when we get down to actual services and service lines where I may not even have the capacity, all of my brand building and all the work I'm doing is lifting that, and I'm actually not even able to service that. How, Matt, how have you kind of, you're working with a lot of customers who are facing this? How do you think about that? Like, I think what you put it to me, which I found was like a really great way to explain it, out of stock. How do you like manage marketing? Some of the stuff you do is SEO. You have very limited, it's really difficult to control and throttle that kind of strategy down to like limited capacity service lines. Like, how do you think about that stuff?
Yeah, well, it is certainly a loose correlation, but a correlation to, e-commerce where you've got in stock, out of stock constraints, and whether it's advertising or organic or earned efforts to, focus your dollars or efforts, time on things where there are capacity constraints or your products are out of stock isn't always going to be the most effective. And the brand building piece becomes really, even more important. But also there have been some innovative organizations that also focus on times like that on actually how can we build our brand through trying to help people not need care? Like, how can we help on the wellness front so that people aren't having to come in for an appointment? And it sounds very counterintuitive in that, why wouldn't you want someone to come in and come in and have an appointment? But that can be a great opportunity to really build your brand over the long run and really develop a relationship with those, future patients where you can focus your content strategy or marketing strategy, a portion of it on wellness and keeping people healthy and avoiding complications or avoiding them coming back after they just had surgery because they had some sort of an issue that could have been prevented. And so there are some innovative strategies there, and it just again requires that break out of the mindset, in particular with digital, which is what we deal in, of the direct response driving digitally scheduled appointments or driving appointments and attributing a specific ROI to what are our goals and efforts organizationally, and then how can we leverage some of these other areas within digital to provide that experience and tailor, not personalize necessarily, but tailor some of the branding efforts to what people are looking for, which is in many cases not going to just be the point at which they need care.
Yeah, great call out. Matt, we have a summary slide if you can bring us home here.
Yeah, absolutely. I mean, it was a very insightful conversation. I think that, a lot of what we heard today is very similar to a lot of the conversations that I've been having. I think there were some interesting calls that Alex had around, it being interesting that a lot of the people on this particular conversation, it wasn't as top of mind the challenges with AI and the non-traditional competitive space. So it might just be interesting for anyone who didn't rate those to think about that after today. But that increased competition piece, being a big factor, both traditional in different geographies. We're seeing a lot of traditional competitors entering new markets that they weren't in before. On top of the non-traditional competitors, we certainly hear everyone on the challenge of balancing privacy and doing the sort of quote unquote attribution piece to understand what is effective marketing, really requiring to make sure that you have that foundation, not just of privacy first, but also what your goals and objectives are, and then what's the best path to get the most data and understand the constraints around that data. And then lastly, looking beyond just performance marketing or brand and how they play a role together, especially in the digital space. I think those certainly, are three of the key themes that came out of the conversation today, but interested to hear any questions that anybody has that maybe we didn't cover.
Yeah, just one more wrap up before we get into a few minutes of questions. Matt, we've done one of these together. About 2 years ago, I said to our events team, hey, like I want to build an opportunity. It's not about us, it's about healthcare marketers. I want to build a way for them to get together and compare a lot of these notes and see where each other lands and some of the pressures people are facing in different markets. And we started this. We did one event in person. Matt and I have done some of these events together. Now we've done 30 already this quarter, so there's a lot of opportunities. One's coming up in Orlando around HMPS. we're hosting an event on May 1st. So if you have any interest, just go to freshpaint.io/live and you can register to come join a bunch of other healthcare marketers and continue this conversation. So it's really meant as a way to connect folks and share notes. So yeah, let's get into the question. So I think there's a pretty meaty question that came in that may take all 5 minutes, because the one theme that was pretty universal across a lot of the responses is this inability to track. Like, used to be you just put pixels, Meta, Google Analytics tracker, Google Ads tracker, whatever, impression pixels for a DSP for brand. But now the new world is like, you can't just throw those native pixels on your website without a lot of caution. And so if you start removing them, you lose this attribution. You lose the understanding of how these things work. Teaser, there is a way. I'm not going to like do a bunch of product plug, but it's a shift from third-party data where you just ship everything away to Google and Meta to help inform their advertising strategies, to a world where it's first-party data. It's your customers' data. You're sharing it with them because you're trying to improve the experience of those consumers, as Alex talked about. Um, yeah, I'd love to just spend, because I think there was a question that came in, is like, I can only track Google Ads. I can't even get visibility to how tools like Meta are working. And the answer is you can. You just can't do it the old way, unless your legal and compliance team are okay with that. But then you run the risk of a lot of different like multi-headed dragons of privacy. How do we move forward? Like Alex, how are you doing it today? Like, you don't have to get into product plugs today. It's more of like, how have you figured out how to navigate that to do both privacy and measurement?
Well, I think you covered on that, and I'm trying to be careful and not
Yeah.
step on that plug, but there are tools out there that can help you get that first party data, and that really is the key in helping you link a lot of these events, and then be able to tell a full story around a certain patient or certain group of patients, and be able to give them that more personalized experience.
Yeah, I would say I think the underlying theme is taking ownership of the data, and not just relying on it was easy to add the tracking tag and see the number in our platform, but it is the hard work of saying, where are we, what are we doing, and then how are we measuring that? And that really requires then what's the best ways to own our data as much as we can, and make very specific decisions about what we're going to share with others, as opposed to the default, we'll put anything on our website and share all the data. You don't have to do that to be effective. I think a lot of people thought that just because that's what they were doing, that if they were to not share all of the data with a Meta or a Google, that they would be far less effective, and that's not true. You can share far less data and still be successful, and sometimes even more successful, by leveraging some of these tools, that allow you to take control over your own data. So I completely agree with you, Ray. There are ways, in our opinion, I'm here and we have a background of having a lot of great conversations together, because we're advocates of Freshpaint as an option. But that software that allows you to take the ownership, which is the most critical piece, and then force you to make your own decisions around what data you're going to share, and force you to think about why you want to share that data and how it's going to help you. And therefore, then you'll come to the realization that there's a lot of data you don't need to share, but you can still be successful with sharing a much smaller subset of the data.
That's been the biggest, like, this is no longer a theoretical conversation. It's an actual we have hundreds of customers who have moved off of all those native trackers and use first party data instead, and still have the same goal. Like, I'm trying to hit a KPI like CAC out of Google Ads. I know I have to send some data. The crazy learning is all the data that Google Ads used to gobble up, it only needs a fraction of that data for it to work for you. Now, Google wants all the data because they're trying to make it work for them. Google and Meta together, 250 billion in advertising, revenue. The more consumer data they collect from us that we won't even get the benefit from, some other advertiser will get it. That's kind of the scheme here. So you can make it all work really effectively. And then we've also seen the advantage of shifting to first party data. The old way, you just sent it away. now you have this data and you can do more with it. We've actually have customers who are now linking ad click in Google Ads down to desired goal, like an attended appointment versus just a web form fill. And then that means that you can actually do a better job of actually measuring CAC effectively, the actual CAC versus a theoretical, to the ad click. And you can actually have better data signal to get back to the ad platform. So there's just like a future projection of like, there's going to be more and more you can do to link, from the top of the funnel all the way down to success and beyond, because now it's your shared data with your customer versus you putting some kind of like signpost for Meta on your site and just shipping that data off without any control over it. So a lot of advantages that go way beyond just privacy for privacy's sake of first party data. I really enjoyed this conversation with you, Alex. Like you have, I want to talk more with you about AI because there's just so much I don't know there, and you kind of like tease some of it out. And Matt, you always have an incredible amount of knowledge on the analytics side and how to navigate this stuff. So thank you both for being part of this.
Yeah,
Thank you. It was
great
fun.
conversation.
Yeah. And thanks to everybody who joined and stuck through the full hour. I know that the team will be following up with recordings and all that stuff so you can socialize these thoughts and ideas internally. But thanks again, everybody, and hope everybody has a great day out there.
Great. Thank you, Ray. I'm sure the audience joins me in thanking you and Alex for this important and timely discussion. And thanks to our audience, like you just said, for taking time to join us today. That concludes our program. We hope to see you at future forum webinars, as well as the Healthcare Marketing and Physician Strategy Summit, April 29th to May 2nd in Orlando, Florida. Please visit the forum website, healthcarestrategy.com, to learn more. Finally, be sure to give us your feedback by completing the evaluation survey as you exit the webinar. Thank you and have a great day.